So let's do one more question, but let's change it up a little bit. The last two items were delegation, so let's try assignment making. It is not as common, but there is a chance you still may see it, and I want you guys to feel confident when you do see an item like this potentially pop up on NCLEX. So instead of delegating, it is making safe assignments for a client. So a charge nurse is making client assignments for a critical care step-down unit. Which client would be most appropriate to assign to a new grad RN? And I know some of you might be thinking, well, we just talked about scope of practice, and the RN can care for any patient. And you are right, but remember, we are at that magical NCLEX hospital where staffing is perfect and we can be very selective. And so we want to give that new grad a very stable patient with a simple care plan, okay? Even though they can care for any of these. So option 1, a client admitted for diabetic ketoacidosis on an insulin drip, a client who is scheduled for discharge today with a new colostomy, a client scheduled for a pacemaker insertion procedure during the shift, and a client admitted for postoperative infection who's receiving IV antibiotics. And I know a lot of you guys are making some great guesses right now, so let's talk about each option in a little more detail and tease out some more learning. Option 1, the client admitted for DKA that is on an insulin drip, which means IV insulin. So why would I not want to give that to a new grad? It's because that client with diabetic ketoacidosis typically has a very complex care plan, especially if they are still in an early enough or acute enough phase to require IV insulin. It's typically going to be very frequent glucose checks, hourly or more frequent, and they are getting IV insulin, which is one of the most high-risk drugs we can give, okay? If we accidentally bolus insulin, there's a good chance that we can that patient can code. So that is a complex care plan that I would really ideally like to assign to a nurse that has a lot of experience administering IV insulin and caring for clients with DKA. So option 2, a client scheduled for discharge today with a new colostomy. So discharge today sounds pretty simple, but I didn't see a lot of people guess that. So why do we not like that option? Well, when a client has a new colostomy, that is going to require a lot of client education. They need education on site care to prevent infection, excoriation, but also a lot of psychosocial and discussion of lifestyle modifications and that type of thing. So ideally, you want to give that to a nurse that has a lot of experience with colostomies, wound care, that type of thing. So I agree with you guys. Option 3, a client who is scheduled for a pacemaker insertion procedure during the shift. And I didn't see a lot of people guessing option 3 either. Why? Why would y'all not want to assign that to a new grad nurse? Client going for a pacemaker. Well, when a client returns back from their pacemaker insertion, we have to very, very closely monitor their cardiac rhythm. We have to make sure everything's working properly, make sure that they have adequate perfusion, and a lot of things can go wrong there. So you really want a nurse that has a lot of experience with cardiac rhythm interpretation or ECG interpretation. So ideally, you'd probably want a more experienced nurse if you can. And y'all are correct. Y'all also said that there's a lot of teaching associated with the surgery, and that's true too. A lot of times patients will have a lot of questions before and after surgeries. And then the last one, y'all all love this, and I agree with you guys. The client admitted for a postoperative infection who's receiving IV antibiotics. Ideally, that is a very simple care plan and will typically just require monitoring vitals, administering antibiotics, that type of thing. So I agree with you guys. But let me give you an example of when maybe that wouldn't be the best client. Maybe it says a client admitted for a postoperative infection receiving IV antibiotics who now has tachycardia, hypotension, elevated lactate levels. What would that indicate? Somebody that has an infection who now is hemodynamically unstable. They're tachycardic, hypotensive, having an elevated lactate. Can anybody tell me, bonus question, what you would be worried about if that was your client? I'm going to be worried about sepsis. So in that case, I am not going to want to give that to a new nurse. Very good, guys. So we got that correct as well.